Hey, I'm Marilyn Miranda, and I'm the director of the Children's Environmental Health Initiative. In the United States, you can draw a direct line between slavery, the segregation policies that followed the ending of slavery, and the distribution of where people live in the United States even today. There is an enduring legacy. We are very interested in whether or not that enduring legacy of racial residential segregation has an impact on children's health. Childhood lead exposure is a classic environmental justice problem. Children of color, in particular non-Hispanic Black children, are exposed to more lead. And racially segregated communities, not only do they have higher levels of lead exposure, but there's a whole series of other adverse exposures that are going on at the same time. Other adverse environmental exposures, other adverse social stressors. Childhood lead exposure has been linked to a whole series of negative effects in children. We see lower test scores, we see lower IQ, we see more behavioral and learning disorders, and the more we look into the question, the more we understand that even very low levels of lead exposure have an adverse impact on children. So we're very fortunate to have a long-standing relationship with the North Carolina Childhood Lead Poisoning Prevention Program and to have access to the blood lead testing data all the way from 1990 forward. And we have information on how racial residential segregation has changed over that 25-year time period. That allows us to assess the question, is there an enduring relationship between racial residential segregation and elevated blood lead levels? The good news is, over this 25-year time period, blood lead levels did decline, and they did decline almost everywhere across the state. The bad news part of the study is that we continue to see exposure to lead amongst children as evidenced by their blood lead testing data. And there are also a substantial number of communities in North Carolina where racial residential segregation increased, meaning that communities became more segregated. In our analysis, we found that in 1990, there was a very strong relationship between communities that were very segregated and children who had more elevated blood lead levels. When we looked at that same question in 2015, unfortunately, that relationship persisted. I'm hoping that pediatricians pay attention to three things. Number one, the continued need to test children for lead exposure, particularly children who are living in high-risk housing. Number two, the continued importance of ensuring that we have safe and healthy housing available to all of our families, and in particular our families with children. And number three, the continued importance of racial residential segregation on outcomes for children. We're trying to shift the focus from the use of the non-modifiable race as an explanatory factor to using racial residential segregation as a measure of the experience of racial minorities in our country as the explanatory factor. We can do better by our children by leveraging the enormous amount of data that's out there about where children live, what they're exposed to, how those exposures shape their outcomes. As a society, we can and should be doing better by our children.